I was at the nurse's station finishing the evening notes when Betty came in from the staff room holding a folded nursing journal against her chest, her blonde hair pinned neat under her cap, and her face wearing that look she got when something had unsettled her. "Annie," she said, lowering her voice. They were speaking about the National Association of Colored Graduate Nurses in the lounge. I didn't know much about it. I kept my pen still for a moment, because there are some names that are not just names. They carry women inside them, tired women, brilliant women, women who had their hands washed clean, their uniforms pressed sharp, their minds trained properly, and still had to stand outside doors that less qualified people walked through without a second thought. "Yes," I said, "I know about them." Betty came closer and put the journal on the desk between us. One of the nurses said black nurses needed their own association because the white nursing organizations wouldn't always let them in. Is that true? Before I could answer, Dr. Brad Mitchelle stepped out from behind the curtain near bed 4, chart in hand. He had been checking Mr. Harris's pulse, but I could tell he had heard enough to know this was not ordinary war talk. "It is true," he said quietly, though he looked at me as if he knew it was not his story to carry. I looked down at the journal, then back at Betty. The National Association of Colored Graduate Nurses was not formed because black nurses wanted to be separate, I said. It was formed because separation had already been forced on them. They had trained. They had passed. They had nursed the sick, delivered care in homes, hospitals, schools, and communities, and still many were treated as if their skill had to be questioned before it could be believed. Betty's face changed. She was not foolish Betty, just protected by a world that had not made her fight for the same small permissions. "So what did they do?" she asked. I folded my hands in front of me. They organized. They wrote letters. They kept records. They spoke for one another. They pushed for proper recognition, proper training, proper jobs, proper respect. They made sure black graduate nurses were not erased. Martha Minerva Franklin and women like her understood something very important. If the door is barred, you do not simply stand there being grateful for the wall. You gather your people, name the injustice, and push until the hinges weaken. Dr. Mitchell leaned against the desk, his expression serious. "That takes courage," he said. "No," I answered, perhaps sharper than I meant to. "It takes courage to run into a burning building once. It takes something deeper to wake every morning knowing the building was built to keep you out and still walk toward it in a clean uniform." Betty swallowed and looked toward the ward. Mrs. Whitcomb was in bed too, a white woman with a stiff mouth and eyes that slid away from me whenever I came near. She would let me change her dressing, fetch her water, lift her pillows, but she rarely said my name and almost never called me nurse. That was the little cruelty of it. Not always shouting, not always signs. Sometimes it was silence. Sometimes it was the refusal to look. Sometimes it was a patient asking Betty a question about the very medicine I had just explained. Betty followed my gaze and seemed to understand. "I suppose it is not just history then," she said. "No," I told her. "History is not dead just because someone prints it in a journal." Just then, Mrs. Whitcomb called out, "Miss, could someone come here?" Betty moved first, but Dr. Mitchell gently lifted a hand. "Nurse Annie is closest," he said. It was a small thing, but small things can crack old patterns when spoken at the right moment. I walked to the bedside and asked Mrs. Whitcomb what she needed. She would not look at me at first. "My dressing feels tight," she said. "Then I'll check it for you," I replied. My hands did what they had been trained to do. I loosened the bandage, checked the wound edge, looked for heat, swelling, seepage, the ordinary signs that tell a nurse what the body is saying before the patient has the words. Dr. Mitchell came to stand nearby. "What do you think, Nurse Annie?" he asked, clear enough for the patient to hear. I knew what he was doing. I also knew it should not have taken a doctor's voice to make my knowledge visible, but I was not too proud to use a door when one opened. "There is no fresh bleeding," I said. "The dressing was sitting too tight across the crease. I'll repad it and leave room for movement." He nodded. "Agreed." Mrs. Whitcomb looked at me properly then, perhaps for the first time. Not warmly, not suddenly changed into some saint of fairness, but properly. "Thank you, nurse," she said. Nurse, one word, 5 letters, a whole battlefield. When I returned to the station, Betty was quiet. She touched the journal with her fingertips. "They should teach this," she said. Not just to colored nurses, to all nurses. I gave a small laugh, not because it was funny, but because truth often arrives late and expects praise for finally knocking. Yes, I said, they should teach that nursing history is not only made by the women whose portraits hang in clean halls, it was also made by the women kept out of those halls. Women who served during epidemics, in poor neighborhoods, in segregated wards, in homes where no one else would go. Women who were told they were less, then became the proof that they were not. Dr. Mitchell closed his chart. Would you speak about it at the next staff teaching? He asked. Betty's eyes brightened. You should, Annie. I looked from one to the other and felt that old carefulness rise in me. A black nurse does not always get the luxury of simply speaking. We measure rooms. We read faces. We count who is listening and who is waiting to punish the truth for being inconvenient. I will speak, I said at last, but I will not make it soft so everyone can swallow it easily. The National Association of Colored Graduate Nurses was not a polite footnote. It was a fight for dignity, and if we speak of it, we speak of why it had to exist. Betty nodded. Then we'll speak of that. The bell rang from the far end of the ward, and the evening carried on as it always did. Medicine cups, folded sheets, polished floors, low voices, pain eased where it could be eased. But something had shifted. Not enough to change the whole hospital, not enough to undo every slight or open every locked door, but enough for that little circle of space around the nurses' station to feel different. I picked up the journal and smoothed the page with my hand. I thought of those nurses before me, women who had stood with straight backs in a country that wanted them bent. I thought of Martha Franklin. I thought of every black nurse who had entered a ward knowing she would have to be excellent before she was even allowed to be ordinary. Then I placed my cap straight, lifted my notes, and walked back onto the ward. Because when I walked, I did not walk alone. I walked with the ones who organized, the ones who endured, the ones who refused to disappear, and the ones who made sure that when a black woman put on a nurse's uniform, the world would one day have to call her by her rightful name.